Hello everyone, I'm Dr. Divya Raghavan, and today we're going to talk about low back pain in dancers. So, low back pain, it has this mystery behind it. It's extremely common. A lot of healthcare dollars are spent on managing chronic low back pain, and if you go to see a physician with low back pain, they might have you do an x-ray, an MRI, give you muscle relaxants, painkillers, but you know what? The most common kind of low back pain is non-specific low back pain. So 80 to 90% of low back pain is non-specific, and 80 to 90% of low back pain can get resolved without the need for any injections, painkillers, or any invasive procedures. So low back pain is very common in dancers because obviously we put a lot of stresses on your back. You're either standing for long periods of time, twisting, bending in awkward positions, doing jumping, leaping. All kinds of dancers are prone to low back pain. Now, the common low back injuries or causes of low back pain I see in my clinic is, as I said, non-specific low back pain, very, very common. There are stress fractures to the low back. Not very common, but it can happen if you're doing a lot of acrobatics and gymnastics kind of movement. Lumbar disc disease. So you must have heard of the disc. So the disc is always lies between two vertebrae, and the disc kind of helps in absorbing shock. So lumbar disc disease could be if there is like a tear in the disc. If because of repeated overuse, the disc gets thinned out with time. So disc disease can lead to symptoms of nerve impingement, can lead to sciatica, can lead to lumbar stenosis, where you will feel achiness and pain going down both legs. Again, if you feel that you have any of these symptoms, or if you've had low back pain, sometimes what happens is low back pain happens in bursts, right? You have back pain, it gets better, then you have it again, it gets better, you have it again, it gets better. Sometimes the first few times the low back pain occurs, it kind of gets better without intervention. But then later on, the time that the low back pain stays for is longer. So initially when you have it, it gets better in a day. Then you have it, gets better in 2 days and 3 days. And then the next time you have an episode, it kind of stays for 7 days. Sometimes I have patients call me and tell me that, I woke up and I didn't think I did anything abnormal, but now I cannot like straighten my back. My back seems to be like not very strong. It has kind of given way. So again, these are very common complaints, and that's why, as I said, there's a mystery behind low back pain. It's very stressful, especially it's a region you can't really see, and so people don't know what's really going on. So if you have any of these symptoms and you feel that it's not helping out, feel free to reach out to me. I will share my contact info at the end of the video. But right now, let's talk about some self-care strategies that you can do if you are in pain, or even to prevent low back pain. So let's get started. So this stretch is the hip flexor stretch. Hip flexors are these muscles in the front of your groin and upper thigh. Usually if the hip flexors are tight, they will cause your pelvis to kind of tilt anteriorly, so increasing the arch in your back, and then that can cause low back pain. So in order to stretch the hip flexors, you start in a kneeling position like that, and then go into a half kneeling position. This position is known as half kneeling. Make sure to kind of tilt your pelvis backwards, right? Tuck it in, and then lunge forward to feel a stretch in your hip flexors. Hold that stretch for 20 to 30 seconds. Again, if you feel in those 20 to 30 seconds that the muscle is kind of loosening up a little bit, you can go a little bit more forward, but make sure that you don't lose that tucking in position and don't let your pelvis come forward. So in the next stretch, we're going to stretch a muscle, which is your piriformis muscle. So you're going to cross your ankle over your opposite thigh, hold that thigh and pull it towards you, while using your elbow to kind of push this thigh outwards to feel a stretch in your right glute or right piriformis muscle. Hold the stretch for about 30 seconds. Relax the rest of your body. Breathe in, breathe out. Try to pull the knee as close as you can while keeping the low back flat on the floor. Let go and then repeat on the other side. All right, so we talked about two good stretches to help reduce your low back pain, which is the hip flexor stretch in a half kneeling position and a piriformis stretch where you do the figure of four or cross your ankle on the opposite knee. The next two things we're going to talk about is stability. So one of the most important muscles to give stability to your low back is your transversus abdominis muscles. These muscles are on the front of your abdomen, slightly towards the side. And if you keep these muscles engaged and strong, they will help give support to your low back. A lot of people do like sit-ups or crunches like a core exercise, and it's not a bad core exercise, but it's not the best. Sit-ups is mostly, and crunches are mostly for your rectus abdominis muscle, which is your six-pack muscle. And although that muscle is important for vanity reasons, right? Everybody wants a six-pack, but it's not a great muscle to give stability to your low back. Instead, the transversus abdominis is a better muscle to strengthen. So I'm going to show you an exercise to help strengthen your transversus abdominis. In this, you'll be lying down on your back with your knees bent, and then you will pull your navel towards your spine. So you'll squeeze your abdominal muscles, and then use the fingertips of your index and middle finger on the sides of your abdomen to make sure that you're feeling contraction of that muscle. So this is very simple. You just feel the contraction. Make sure you continue to breathe, because a lot of people, what they do is they hold the breath while they do this exercise, and as soon as they let the breath go, the muscle contraction also goes away. You have to strengthen your transverse abdominis so much, or be aware of that muscle, so that you can keep it contracted while you're walking, while you're running, while you're jumping, and especially while you're dancing. Dancers need to have a really good core. So if you find yourself kind of skipping on your conditioning workout, and you go from like being busy throughout the day and then straight away into your dance class for an intense dance rehearsal, then there are more chances of you injuring your low back. Instead, during the weeks, when on your off days, when you don't have your classes, take some time to do core exercises. And good exercises for the transverse abdominis would be like planks, leg extensions, even things like biking, running, where you keep your abs engaged, are good exercises. Weighted squats, lunges. As long as you keep that transverse abdominis engaged in activities, it helps with strengthening of that muscle. So the next exercise that's important for stability is your gluteal or buttock strengthening. So the gluteal muscle and the ab muscles are like friends, right? So if the ab is strong, the glute is strong. If the glute is strong, the ab is strong. And both muscles together are the most, the big muscles and important muscles for low back stability. So for the glute, a very good exercise, again, there are so many exercises for the glute, but the one I'm going to show you is called the bridge. In a bridge, you go ahead and lie down on your back with your knees bent. You do a pelvic tilt. That means you tuck in your pelvis, and then you squeeze your buttock muscles and you raise your hips up. You hold it for 4 to 5 seconds and then slowly lower it down. The important thing to remember here is that this exercise is for the glutes and not for the hamstrings. The hamstrings are the muscles on the back of your thigh. A lot of people, when they do this exercise, if they don't tuck in their pelvis and squeeze the buttock muscles before raising their hips up, they end up using more of their hamstring. So at the end of the exercise, they feel that their hamstring is cramping or that muscle is feeling sore, but they don't feel anything in their glutes. The other thing I've noticed with this exercise, a common mistake that people do, is they tend to use their low back too much. So when they're raising their hips up, they do it like a yoga pose where they try to go as much as they can. And when they raise it very high, they lose that pelvic tilt and they end up like overarching their low back and actually feeling more low back discomfort at the end of the exercise. So remember, any exercise that you do for low back pain relief should not cause you low back pain. So when you're doing an exercise, if you're feeling back discomfort, doesn't feel right, don't do the exercise. Stop it, adjust your form, do the exercise again. If it still hurts, then probably you're not ready for that exercise. So I hope you enjoyed learning about how to care for your low back pain. Try these exercises at home. If you feel that you have any further questions, give me a call, send me an email, and I'll be happy to help understand what's going on in your low back. We offer phone consultations, so you can exactly talk about your symptoms of the low back, and I can help assess it. If you're ready, you're welcome to hop into a video visit that we are offering right now when people are quarantining themselves, where again I can talk to the dancers, understand what's going on, do a mobility assessment, do a stability assessment, and give them a customized recovery plan so they can get back to living a pain-free life. All right, so you will see the details for that tele rehab visit by clicking on the link below.